Hello, everyone, and welcome to What You Must Know About Performing Procedures.
My name is Linda Gough, and I'm the Registrar and CEO of the College of Medical Radiation and Imaging Technologists of Ontario. It's a great pleasure to be here with you today, talking about our new What You Must Know About, our new publication. So, our What You Must Know About Performing Procedures is a publication, practice guidelines that help our members, our medical radiation and imaging technologists, make sure that they have all the elements in place to be able to perform procedures legally and also safely. So, two very important points as MRITs practicing in Ontario. So, our newest What You Must Know About includes changes to the HARP Act and forms of energy regulations that just came into force on July 1st. And so they're set out in there. It's available on our website, and it was emailed to all our members last week, in fact. And don't forget, of course, to use our practice advice team, who are here to help you navigate through practicing as an MRIT, and of course, the legislative framework that goes along with that. So, as MRITs, you already know that you do this every single day with every single patient, is you make sure that you're performing your procedures on your patients safely, effectively, and ethically. And your practice meets the requirements of the Ontario legislation, um, and of course the college's standards of practice and code of ethics. Because as a regulator, it's our job to set the standards of practice of the profession. So the Ontario legislation that we all function under um, is multi-layered, multifaceted. There's lots of different pieces. It's incredibly complex, especially for our profession, because all the different forms of energy that MRITs use are regulated by a different piece of legislation. So that doesn't make it easy. Um, but it's important for us to remember that the entire legislative framework for all regulated health professionals in Ontario has been created by the government to ensure the protection of the public. So that's ultimately what everything is about. And we are here, the CMRITO is here to explain the legislation to our members in all 5 specialties of radiography, radiation therapy, nuclear medicine, MRI, and diagnostic medical sonography. And we provide resources for you. So this is one of those resources to assist you in your daily practice. So this document is separated into 2 main parts, and then we have a number of appendices. So I'm just going to kind of look over and review for you what you can expect to find in here. So part 1 has the legal requirements and conditions required for MRITs to perform a procedure in these 4 areas. And so we're going to look at these in more detail later on. So we have to be practicing within the scope of practice of the profession, knowledge, skill, and judgment. Make sure you have the appropriate order in place. And then there's some other conditions that you need to meet as well that we'll review. Part 2 of the publication talks about some other issues. So delegation, fetal ultrasound for non-medical purposes, and also students and applicants. So a really important part there that all MRITs need to be aware of. And then we have a number of appendices. So we have 3 appendices that has detailed information on the ordering and applying of 3 of our forms of energy. So ionizing radiation, electromagnetism, and sound waves. So you can find all that detailed and up-to-date information there. And at the very end is a decision-making guide, which we'll review later, but it's a one-page summary of all the pieces that we're going to be talking about today and are included in the What You Must Know About. So first of all, scope of practice. So MRITs must perform their procedures, including their authorized acts, only in the course of engaging in the practice of medical radiation and imaging technology. And of course, this is set out in the MRIT Act, or the Medical Radiation and Imaging Technology Act, which is the act that creates the college and also describes the practice of the profession. So the scope of practice, I'm just going to
highlight this one so you can see it a little easier. The scope of practice of the profession is set out in the MRIT Act is the use of ionizing radiation, electromagnetism, sound waves, and other prescribed forms of energy for the purposes of diagnostic or therapeutic procedures, the evaluation of images and data relating to the procedures, and the assessment of an individual before, during, and after the procedures. So we've got all the elements there of all 5 specialties. So every specialty uses a form of energy to perform diagnostic or therapeutic procedures, evaluate the images and data relating to those procedures, and also assesses the patient prior to performing the procedure, during the procedure, and after, to make sure that the patient is taken care of appropriately.
So other things that you do every single day is you have to make sure that you have the knowledge, skills, and judgment to perform the procedure. So you have to be competent and you have to maintain your competence in the area of practice to make sure that you're performing procedures safely, effectively, and ethically to ensure safe, effective, and ethical outcomes for the patient. So you'll see lots of focus on that. This is about patient safety, right? And members are competent and do make sure that they have the knowledge, skills, and judgment to perform their procedures every single day. You also have to have an order, and our standards of practice, and in fact, other pieces of legislation require the order, but the standards of practice require that MRITs ensure they have the appropriate order for the procedure, treatment, or intervention prior to performing every procedure, treatment, or intervention. So that's an important part. You need to make sure that you've got that order in place before before proceeding. So what is an order? Well, it depends on the legislation, and but holistically, the order is an authorizing statement from a regulated health professional with prescribing authority, permitting MRITs to perform a procedure, treatment, or intervention. It's also known as a requisition, a protocol, medical directive, or treatment plan. So, who can issue the order? The regulated health professional with ordering authority. And that depends on the procedure because the legislation governing the procedures depends on the form of energy, depends on the authorized acts, and so it's complicated. So that's where we're here to help navigate through all that. And of course, our What You Must Know About Performing Procedures contains the current information on who can order and apply forms of energy, because that can change. It's the government who decides who can order and who can apply, and so that certainly can change depending on practice and the needs of the healthcare system and patients. So let's look at our forms of energy who can order the application of ionizing radiation. So this is how it appears in our What You Must Know About, or in the legislation. So the Healing Arts Radiation Protection Act says that the order for applying a form of or ionizing radiation needs to come from a physician or another authorized health professional who's listed in the HARP Act or in the regulations. And so it's the regulations part that can change. So let's have a look at that. So, who can order the application of ionizing radiation?
So it's a member of CPSO, so the College of Physicians and Surgeons of Ontario, a member of the Royal College of Dental Surgeons of Ontario, so a dentist, and that includes dental CTs. Chiropodists and chiropractors, of course, can order within their area of practice. And a member of CNO in the extended class, nurse practitioners can order all types of x-rays. And since July 1st of 2022, that also includes CTs. So that was the new part that we informed all our members about. So who can apply ionizing radiation? Again, a member of CPSO, an RCDSO, chiropodists, chiropractors, dental hygienists, and also a member of CMRITO. So that's what the regulations say in the Healing Arts
Radiation Protection Act. So, what about radiopharmaceuticals or radiation implants? Because it's another form of radiation, but it's not an X ray machine. And so, there's a bit of a difference here because, of course, they're not subject to the HARP Act. So, nuclear medicine procedures, the order must come from a person authorized under the regulations made under the Public Hospitals Act or in accordance with generally accepted Professional Standards Act under the Independent Health Facilities Act. So you can see that that really depends on where the practice is happening, and you have to make sure that there is an order under the place of practice. So this is because these materials are regulated under the Nuclear Safety and Control Act and the Radiation Emitting Devices Act, and that covers the safe handling of radiation sources, but it doesn't cover the use of these sources on patients. So, because we're talking about patient legislation in Ontario, these don't apply to the actual delivery of the form of energy to the patients. But of course, all procedures done on any patient require an order from a person authorized under the Public Hospitals Act or under the IHF Act, depending upon where it is that you're practicing. So let's look at who can order electromagnetism for MRI. So, in the legislation, this is covered under the Regulated Health Professions Act. The order must be from a physician or other authorized health professional listed in the Controlled Acts regulation. So, who is that?
So again, it's a member of CPSO, a member of RCDSO, so a dentist who holds a specialty certificate in oral and maxillofacial surgery, and a member of CNO in the extended class, so a nurse practitioner. So the last two are in fact new, effective as of July 1st, 2022. Prior to that, it was only physicians who could order the application of electromagnetism for MRI. And who can apply? A member of CPSO and also a member of CMRITO. But we know it's not often that a member of CPSO is doing this. It is members of CMRITO in the specialty of MRI who are doing this.
So who can order the application of sound waves for diagnostic ultrasound? So again, this one is covered under the Regulated Health Professions Act and the Controlled Acts Regulation.
And it's a member of CPSO, midwives also for pregnancy or pelvic diagnostic ultrasound, and a member of CNO in the extended class, so nurse practitioners. So no recent changes to that. That has been in place for a number of years now. And who can apply sound waves for diagnostic ultrasound? We have a member of CPSO, midwives for pregnancy or pelvic diagnostic ultrasound, a member of CNO in the extended class, so nurse practitioners, and then a member of CNO, so RNs or RPNs, other than NPs, of course, for routine nursing assessment. And a member of CMRITO is also authorized to apply sound waves. So the members of CNO, other than NPs for their routine nursing assessments, that is the nurses who are doing nursing assessments such as checking urinary retention in bladders of their patients, that kind of thing. It's certainly not the full diagnostic ultrasound examination.
So then let's look at authorized acts. So members of CMRITO are authorized to perform 5 authorized acts, which we'll go through in more detail. And for this one, the order must be from a member of the College of Physicians and Surgeons of Ontario. So that's it. It's only member of CPSO who is able to give MRITs the order to perform their authorized acts. So we'll look at those in more detail later on, but I'm sure you know that, and we'll discuss it again later. So let's talk about types of orders. So what are the kinds of orders that we see in our medical imaging departments and radiation therapy departments? We generally have 2 types. We have direct orders and medical directives or protocols. So a direct order is for a specific procedure, treatment, or intervention for a specific patient by a physician or other authorized health professional. So these are the orders that you're getting from referring physicians or nurse practitioners. And it's for a particular patient for a particular procedure. It must be in writing, authenticated by the ordering physician or authorized health professional, dated. It has to include the patient name and date of birth, the name of the procedure, any details required to administer a substance or other parts of that. And of course, it's always nice to have a relevant clinical history, but that doesn't always happen. But certainly, you need to know the procedure, patient name, and what you need to do in order to be able to legally apply the form of energy that you're going to be applying. Medical directives or protocols are orders for the procedure, treatment, or intervention authorized by a physician and implemented by another individual. So they're always written or documented electronically, cannot be verbal. And in this case, it's the medical directive that is the order. Generally, they contain a standardized reference number. They identify the specific procedure or treatment being ordered. They identify who may implement the procedure, so specifically who can do that, a list of specific conditions and circumstances that must be met before the procedure can be implemented, including any contraindications. We also need the name and signature of the authorizing physician or health professional and the date and signature of the approving administrative authority, be it the radiologist in charge, the radiation oncologist, or even the medical director. So when are these used? When are we using medical directives and protocols? So they're used in our departments to give MRITs the authority to perform the authorized acts required for a particular procedure. So, for example, we will get a direct order from a referring physician or nurse practitioner for a CT scan or an MRI scan. It's the departmental protocols that are established by the radiologists or radiation oncologists that determine whether or not that patient needs to have contrast media. And so the medical directive or protocol will give that individual, that MRIT who's doing the procedure, the authority to administer a substance by injection to the patient. So you've got the order for the procedure from the referring physician or authorized health professional, and then the medical directive or protocol within the department from the radiologist or the radiation oncologist gives you the authority to do the authorized acts that you need for that particular procedure. And you'll remember that we can only accept those orders from a member of CPSO. So, in hospitals and clinics, other applications for medical directives or protocols could be for the ordering of certain diagnostic procedures that are performed by the MRITs, but they're implemented by other health professionals. So, for example, many hospitals will have medical directives for their fracture clinic. So, they will have a medical directive that says the MRIT is able to perform the procedure for the fracture clinic follow-up before the patient has been seen by the orthopedic surgeon. So those are the kinds of times that medical directives or protocols are used. So what conditions must be in place before performing a procedure? First of all, you need to make sure the order's there. You need to make sure you're engaging in the practice of the profession as set out in the scope of practice that we've already looked at. And you need to make sure it's not contrary to any terms, conditions, or limitations on your certificate of registration. So, what does that mean? So, your certificate of registration, of course, is your registration with CMRITO because you can only practice the profession if you are registered with CMRITO. And of course, your registration is on the public register, and everyone has a certain term, condition, or limitation in place.
So here's mine. This is my public register information. And the term, condition, and limitation that's on everybody's certificate of registration says the member shall practice only in the areas of medical radiation and imaging technology in which the member is educated and experienced. So that means that we need to make sure we're practicing only in the areas in which we're educated and experienced. So this is used often in the area of diagnostic medical sonography. So you know that that specialty, in fact, has three principal areas of practice. So general, cardiac, and vascular. And so DMS members will practice in those areas in which they're educated and experienced. And of course, That means that once you are a member, then you can always go and get additional education and experience in those areas and add on areas of practice that you didn't necessarily get trained in your entry to practice program and certification process. So it expands what MRITs are able to do, and make sure that we're able to keep current with changing practice, right? Especially in hybrid imaging, it's important.
Other conditions that must be in place before you perform the procedure: you have to have the knowledge, skill, and judgment, as you know, have to ensure patient consent. And so the CMRITO has other resources around patient consent. And you have to be responsible and accountable. You're responsible, you're accountable for performing the procedure and managing the outcomes safely, effectively, and ethically. So all those things need to be in place before you perform a procedure. And as I said, you do this every single day without even thinking about it, but it meets and ticks all these boxes in the legislation when you're in your practice. Part 2 of the What You Must Know About Performing Procedures talks about delegation. And sometimes members may be asked to accept and perform procedures beyond their principal expectations of practice, and that involves a controlled act that's not authorized to CMRITO members. So, what are controlled acts? The Regulated Health Professions Act, the RHPA, defines 14 controlled acts that can only be performed by authorized regulated health professionals. And then we are authorized under our profession specific legislation, the MRIT Act, to perform 5 controlled acts. So, our authorized acts are administering a substance by injection or inhalation, tracheal suctioning of a tracheostomy, administering contrast media, or putting an instrument, hand, or finger beyond the opening of the urethra, beyond the labia majora, beyond the anal verge, or into an artificial opening into the body. Number 4 is performing a procedure on tissue below the dermis. And number 5 is applying a form of energy prescribed by the regulations under the RHPA. So that's the MRI and ultrasound that we've already talked about. So if we look at these are our 5 authorized acts that we can only do when we're practicing the profession and when we have an order from a member of CPSO. But you remember, we are also talking about you need to make sure you have the knowledge, skill, and judgment to do any of your authorized acts. So, for example, performing a procedure on tissue below the dermis involves everything from a skin prick to a PICC line placement. So, you need to make sure that you've got the necessary knowledge, skill, and judgment to be able to do that. So, controlled acts may only be performed by health professionals in their practice if the controlled act is authorized to them under their legislation, or if the controlled act is delegated to them by a health professional who is authorized to perform it, or an exception or exemption exists. So, the controlled acts delegation is what we're talking about today. So, this is a way of providing other health professionals with the ability to provide additional services to patients that may not be set out under their profession specific legislation. So, this is what this does. And in fact, for MRITs, our 5 authorized acts, in fact, cover most of our practice. There's very little now that we require a delegation for. So, the delegation is the process by which a regulated health professional, usually a member of CPSO, is authorized to perform one of the controlled acts and confers authority to someone regulated or unregulated, who is not authorized to perform that controlled act. So one that comes to mind is the controlled act of communicating a diagnosis. That one is not authorized to members of CMRITO, but there may be occasions, either in the emergency departments or in the nuclear medicine departments, where an MRIT may need to arrange for a pregnancy test for a patient before the procedure is done, and in which case there will be a delegation and also a protocol in place to permit the MRIT to perform the pregnancy test or send it to the lab to get done, and then to communicate that diagnosis to the patient before proceeding with the procedure. But as we said, delegation is something that you need to be aware of, but is not something that every MRIT is doing in their practice. If you're going to accept a delegation, you have to do so in accordance with the RHPA and the Standards of Practice. There needs to be an authorized delegator, and you need to follow the legislation, guidelines, and policies of their regulatory body. So if it's coming from a physician, CPSO have guidelines on how their members are able to delegate. And you can see what you must know about performing procedures for more information in this area. One area that there's a bit of confusion about, because before diagnostic medical sonographers were regulated, in fact, they were performing transvaginal examinations and also administering contrast media through a delegation from members of CPSO. Of course, now you don't need a delegation because you're authorized under the MRIT Act to do that, but you still need the order. So you see where it gets confusing, but that's okay. We've got our what you must know about performing procedures and our practice advice staff to assist you. So let's talk about some other areas of practice that you may not be aware of. So fetal ultrasound for non-medical reasons. So, what is called sometimes entertainment ultrasound or in utero photography. There's lots of different names for it. And we sometimes get questions about this from sonographers. So, of course, it's not in the scope of practice for diagnostic medical sonographers because in our scope of practice, it's the use of sound waves for the purposes of a diagnostic or therapeutic procedure. So, performing fetal ultrasound for non medical reasons is not within the scope of practice of the profession. And typically, there's no order from a physician or authorized health professional, which is another requirement that CMAR ITO members need to have before they perform their procedure. So, fetal ultrasound for non medical reasons would be professional misconduct for a CMAR ITO member to use ultrasound only to obtain a picture or video of a fetus or to determine gender for non-medical reasons. So just a piece to be aware of. Now, of course, the most departments for the diagnostic and medical reasons that these procedures are done, the diagnostic imaging departments will have lots of policies around sharing images and sharing the gender with the patient, but that's kind of a secondary to the main reason for the examination, which is the health of the fetus and the patient. Students and applicants is another area where sometimes people get into trouble. And so we want to make it really clear that you understand how this works and how the legislation works around this. So, as you know, to practice as an MRIT, in Ontario, an individual must be registered with CMAR ITO. So there's no questions about this. This is mandatory registration. In order to practice, you must be registered with the college. So how then are students able to practice the profession? Because they have to learn the profession, right? And this is a profession where you need hands-on, you need clinical experience. So the legislation permits that through exemptions under the RHPA and the HARP Act that permit students to perform their authorized acts and also apply ionizing radiation when they're actively enrolled in an approved educational program and they're supervised by a CMRITO member. So that's a CMRITO approved educational program. So that's all the accredited educational programs in Ontario. And also, they're supervised by one of our members. So that will be your clinical coordinators or CMRITO members who are practicing in the floor. So that's how that works for students. But there's a period of time in between completing the approved program, so they've finished the program, and becoming registered with the CMRITO when the individual is not authorized to apply ionizing radiation and is not authorized to perform any of the authorized acts, including applying electromagnetism and or sound waves. So that's because they're no longer students. So then the exemption no longer applies. So it's that time between completing the program and becoming registered when they write their exam and get their results. And so what we do is work with the students. So we try and get that time down as short as possible so that we're able to get them registered and practicing again. But don't forget that there is that period of time. Our managers are really good at checking to make sure that their new employees are registered. And of course, that is always available on the public register. So just something to keep in mind. Certainly managers can hire students, but if they do that, they need to make sure they're not applying ionizing radiation and they're not performing any of the authorized acts. So more of assistance or PACs or whatever. They can do all that, but just not those legal requirements. Okay. And of course, practicing the profession by applying ionizing radiation or electromagnetism or sound waves, or performing any of the authorized act while not actively enrolled in an approved educational program or registered with the CMRITO is a legal practice. And we will deal with that through the provincial legislation should that happen. So we need to make sure that that doesn't happen. Okay. So the decision-making guide, let's have a look at that. That's the end of the what you must know about. And it asks 4 questions and provides guidance around making sure that you've got all the requirements in place before you actually perform a procedure. So the first one is, do I have the legal authority to perform the procedure? So we've already been through this. Does it fall under the scope of practice? Does it require a controlled act? And if so, is that an authorized act? And so all those questions are asked, and you can go through your process and make sure that you're answering yes to everything, and then you can go on to the next question. If it's not, then you need to stop. And before you do the procedure, you need to take the necessary action. So you're doing this every single day. As I said, this is all set out, but this will be helpful if you're looking at expanding the area that you're practicing in, doing procedures that you haven't done before, or there's a new procedure being done in your department. So it's always good to go back to these things and check. And so this decision-making guide helps you through that. So we're going to say, yes, I have the legal authority to perform the procedure. Then the second question is, do I have the necessary knowledge, skills, and judgment to perform the procedure safely, effectively, and ethically? And so there's a lot of questions in this area too. And so if you're saying, yes, I do, that's great. You carry on to the next step. If not, you need to stop and don't perform the procedure. So sometimes this could be a new area of practice, in which case you need to make sure that you get that clinical and sometimes didactic training so that you're able to perform the procedure safely, effectively, and ethically. Sometimes it's a matter of refreshment, right? Sometimes you might have known how to do this procedure in the past, but you haven't practiced in that area for a long period of time. And so you might just want to work with a colleague and watch them and then have them watch you just to refresh you to make sure that you're comfortable with your level of knowledge, skill, and judgment around the procedure. So when we say yes to this, then we go on to the next one. And that is there an appropriate order in place giving me the authority to perform the procedure? So we've gone through all that. And again, if it's yes, you carry on. If no, then you stop and don't perform the procedure. And you make sure you've got the necessary order in place before you do the procedure. And then the final question, number 4, have all the conditions set out in the CMRITO Standards of Practice been met? So has the patient provided informed consent? Am I able to provide the patient with clear and understandable information and instruction? And so we need to make sure that we're following all these conditions. Remembering too that just because a patient has provided informed consent, the patient can verbally withdraw consent at any point during the procedure. So you're always checking for that, right? You're always checking to make sure that the patient is still consenting to the procedure throughout it. So if you say yes that to all those conditions, then you can perform the procedure. And as I said, you do this every single day, second nature, without even thinking about it. But it's always good to review what are the requirements and what is the legislation behind that's giving you the authority to do those procedures. So that's the end of the presentation. Thank you so much for your attention. I hope you found it helpful. If you have any questions, don't hesitate to contact our practice advisors. And I just wanted to thank you all so much too. I know it's very difficult out in healthcare right now. We're hearing all kinds of stories, and the work that you do in providing competent services to the public of Ontario every single day is noted. And thank you for doing that in a professional way and continuing on to provide those services under what I know is very, very difficult circumstances. Here's our contact information, and this presentation will be available on our website following. So if your friends or colleagues missed it and you think it would be helpful, please point them in the direction of our website, cmrito.org, and it will be available on our website later. So thank you all so much. It was great chatting with you. I miss all your faces, but at least this way we can provide you with updated information that you need to continue to practice professionally and competently. So again, thanks. Have a great day, everyone, and we'll see you next time. Bye now.